Thanks, Andrew. For those of you who saw me last time I took to the stage, I have a clicker this time, so I'm hoping it'll all go smoothly. If you weren't there, don't worry. It's my staff refer to it as Clickergate. It's become a thing. Okay, so yes, firstly, let me congratulate the agency and the Commission for putting on this event. I look in the room today and, you virtually online, there's people in the room here who have been doing digital health and health informatics and e-health and everything that falls under that umbrella for 30 years, upwards of 30 years. I don't remember ever coming to a conference about focusing on the issues specifically around clinical governance in our field. So congratulations guys for hosting it and thank you so much for the invitation. Okay, so pressing the green button, it's showing on here. It's showing on here. Oh, you're seeing it. Okay, it's just not showing behind me. That's okay. You guys can look over there, and then if I fall, it's fine. You won't actually see it happen in real time. Any Last of Us fans? Okay, yeah, there's some people. Okay, you guys are all too busy to watch television, I see that. Okay, well, look, first let me say that I know we aren't really in post-pandemic, but when I was looking at a more accurate description of living in a pandemic, it just didn't resonate as much. So I have written post-pandemic, but I know we're very much in it. Okay, so why are we here today? Because you can't do digital health without having appropriate clinical governance. No-brainer, right? I've literally heard people say that. It's a no-brainer. Well, if that was the case, there's, like Amanda said, there's 700-800 people at this event today in the room here, and the temperature is rising, and there's a lot of bodies in the room for those of you joining us at home and from your desks and from your mobile phones. There's a lot of people here. Why did we come if this is a no-brainer? Did we come just to hang out with the cool kids of digital health? Maybe a little bit, yeah. But we're here because of a joint recognition that these topics and these issues are incredibly, incredibly important. But also a recognition that we don't get it right all the time in the field of digital health. So what I'm going to do is take you on a tour with Joel and Ellie from Last of Us, which some of you have no idea what I'm talking about. Anyway, but you can catch up on the weekend. And we're going to do a 7-stop tour of examples of where we could do better when it comes to clinical governance in digital health. So here's an example. Lack of data privacy and security measures leading to breaches of patient information. That's pretty much a no-brainer. It's this is, people spend their lives just dealing with these issues. These are just a selection of ones that I grabbed. Obviously, Australia, unfortunately, we did hit the headlines last year with what happened with Medibank. But, a lot of us didn't even hear that the health system in Ireland went down last year. We were working with them and they couldn't even respond. We couldn't send them calendar invites to come to meetings, and I had to WhatsApp them and stuff like that to their private. Everything went down in Ireland. And it's not just the EHRs and those digital health systems that are subject to these types of issues. Pregnancy tracker apps, and certainly with what happened with the legal change in the United States last year, 15 million downloaded pregnancy trackers, and this is from a particular company, true story, and in their privacy, because we all read those privacy things, don't we, and tick consent at the end. Well, there's 15 million of this particular app, and it actually says there that they will give your data over to cops if they're requested for it. And most people don't know that. Pacemakers. For those of you who used to watch Homeland back in the day, I've got lots of pop culture references, there was an example where they killed a person by hacking into their pacemaker. If you've got one, don't worry, I'm sure all of those things have been fixed. But this is a real headline, 8,600 flaws in certain pacemakers. So, okay, there's privacy issues in patient information. Number 2, inaccurate or unreliable digital health systems that provide incorrect information to clinicians. Pretty much without doubt, every single clinician I meet who's in the digital health space as a full-time thing, and you ask them about, oh, well, how did you come here? Usually they fall into it. And it's because they say things like, I'm sick to death of spending 30% of my shift looking for information. I don't have it. And also I know someone who actually in this room and told me a really poignant story one day, how he got into this space was because he realised patients were dying on his watch because he didn't have the information. It wasn't that he was making the bad calls, it was he was doing the best he could with the information. Well, here's some examples. So things like clinical decision support, electronic prescribing, these are great things. And you know, most of you know me, like obviously I'm an advocate for digital health, don't get me wrong. These things are incredibly important tools and we should be harnessing them. But if we just put things out and without proper testing, they can actually cause harm as well. So while these tools can actually help prevent medication errors, and they're really important, we need to make sure they're designed and implemented and that people are trained appropriately so that they don't actually cause adverse events. And unfortunately, they are examples. Stop number 3, failure to engage patients. This is a favourite one, and other stakeholders in the implementation and use of digital health technologies. That never happens, right? So Fitbit, who is now owned by Google, and I'm sorry if there are anyone here from these companies. I've tried very hard to put like US examples, so I was hoping I wouldn't offend anybody. But these are issues that would resonate with everybody here. So Fitbit was sued in Australia and internationally because those devices that people were wearing on their wrists would heat up and burn them. I owned one for like 10 years, I think. So it never happened to me. I was very pleased. I did get a rash once, but anyway. But you know, there was a lawsuit in the States and in Australia for giving people not just a device that actually caused patient harm, but that the information, another case was about the heart rate monitoring. And this happened to my partner actually. He rang me going, oh my God, I'm having a heart attack. And I'm like, yeah. Really? Like, and anyway, and he calmed, because he was quite panicky, and I calmed him down. Well, what's happening? How are you feeling? And he was feeling fine, but his, it was a different company, it wasn't Fitbit. His other watch was telling him that he was in atrial fibrillation, and he was freaking out and rang me, and he wasn't at all. But you know, anyway, Fitbit got sued because of that lack of information. So we need to engage patients in this process, and that's just one example. Lack of proper training of healthcare professionals of how to actually use digital health technologies can actually cause errors and lead to adverse outcomes as well. Can't tell you the amount of times that we find that people get trained in a device only to go into the hospital or wherever the healthcare service is and find post-it notes everywhere. Victoria Auditor General over 10 years ago now had a great example of people using post-it notes because they didn't actually understand how to properly use the systems. And even when we train people really well in how to use these systems, there's also a problem in that for a lot of people who aren't the converted, who haven't drunk the digital health Kool-Aid, the first time they're hearing about that they could do their jobs differently is when they get told they have to go to a mandatory training class and learn how to use a piece of software that is going to completely transform, and we wonder why they sit there going, great, this is fantastic. You know, like we have to actually train people before we teach them actually how to use a piece of software, and this article goes into a lot of examples of how you do staff training well in this space, but we have to actually train them as to why. You know, back to the why. Why are we here? Why are we asking you to change the way that you practice clinical care? 5, inadequate monitoring and review processes to ensure the safe and effective use of digital. Okay, examples might come to mind. We all know that to err is human, and if you haven't read this report, and I doubt whether many people in this room haven't read this report, To Err is Human is a really famous sort of report that came out quite some time ago, and there's been several updates since then. But what we've seen, and you know, I'm a huge telemedicine fan, and it would really break my heart if we stopped doing that, and I'd like us to use more video consultations. But at the same time, there was data that showed with this rapid expansion globally, not training people, not understanding the systems, how we make sure the information flows, that there has been issues of harm caused from that where people weren't properly trained. Failure to take into account cultural and ethical considerations. This is like my favourite one. It's an old one, but it's a goodie. So Babylon Health in the UK, apparently if I showed up with the same symptoms, I was told I was just having hysteria and everything would be fine. Anyway, and the bloke standing next to me with the exact same symptoms would get told, oh my God, you're having a heart attack. So, you know, there was a gender bias in the way this program was coded. This is not the only example, but there are examples of artificial intelligence being racist. And artificial intelligence aren't racist. They're not sentient yet, I believe. So they're not actually racist. Their coding is flawed. And we need to understand these things to make sure those things don't happen. Adoption of digital health technologies without proper evaluation and assessment leading to ineffective or harmful. Who could it possibly be? Yeah, everyone knows this case, the most famous case of medical misadventure ever to go past. So Theranos, and if you don't know the story, wow, like you've got so many podcasts and shows and TV movies and books to catch up on. But Elizabeth is now, well, I think she's still trying to get out of it, but Elizabeth is going to jail for her $9 billion scandal. And you know what was really interesting and what I thought was a shame in the court's judgment? She's not going to jail because her technology harmed patients. And it did. There's lots of examples of actually causing harm and potentially deaths as well. She's going to jail because she got upset with the people who gave her money and she frauded the investors. So that's what we care about, don't we? We actually don't care about clinical governance. And a couple of questions to have you thinking throughout the day. Is it okay that so many startups are being funded by investors who have little to no knowledge about clinical governance? They don't even think to ask the questions, so do you have any clinicians on your staff? Okay, and then what are their roles in the company? Like, this happens time and time again. Is it okay that there are thousands of health and wellness apps, but there is no consistent way of ensuring their clinical validity? There's a project happening that we happen to be involved in on that, which I'm very excited, but at the moment, no. And most people don't know that. You do in this room, of course, but your family and friends and barbecues on the weekend wouldn't necessarily know that. Is it okay that established health, and we're doing better on this, thank God, we really are, but still the majority of people don't have full access to their healthcare information. And I can't believe it, I still hear arguments about, oh, but if we give people access to their own healthcare information, they're going to get all worried, and I should really, they should go through me. And there has been so much literature published to show that that is not the case. Like over a decade worth of research on that, but it still happens. Is it okay that, do we know for sure that all technology provider organisations and the technologies they employ have clinical governance at the core of their corporate risk governance framework? How many of your boards sit around and talk about clinical governance and are all aware of the Commission's work in this space, and it's embedded into the conversations they're having at their board level about risk? That is not happening as often as it should. Amanda mentioned these data silos, and yes, all of us in this room and many of you at home online, we're working really hard to fix this problem. The data silos are still there though, and the really only reason we need silos is so we can paint beautiful art on them and they can hold grain. We don't need them in healthcare. Is it okay? Do we get a tick of approval from the Commission if we've read the framework, we know about it, there's a poster in the staff room, it's awesome. I can't tell you the amount of clinicians who tell me, and especially actually managers of healthcare services, that say that they pass audits and they know that they're doing the wrong thing. They're not trying to do the wrong thing, of course, but they know the systems aren't quite there yet, and yet you can still pass accreditation. That's a challenge. Anyway, so they asked me here to give an uplifting talk. I'm sure you're all really feeling uplifted now and very inspired. So just finally, this is about you guys. This is about all of you. Gone are the days where your role in clinical governance was because it was in your job title or it was buried in bullet point 3 on your job description. Just like cybersecurity, clinical governance is so critical for every single one of us. If you work in the healthcare space in any fashion, you have a responsibility for clinical governance. And there are so many questions. You guys came here today to think through these issues and to work collectively on how we can do better. And it's so great to have you all here today. So thank you very much. We have really important work to do. It's too important to stuff it up. And I'm so glad you guys all came here today to work on these issues. Thank you so much and enjoy the day. Thank you.